In the densely populated Gaza Strip, the shortage of toilets has escalated to a public health emergency, with United Nations officials highlighting the twin concerns of sanitation and human dignity for the displaced populations living there. This ongoing issue further exacerbates the plight of residents in an area that has long suffered from conflict, blockades, and insufficient infrastructure investment. The Gaza Strip, home to around 2 million people, has been enduring severe economic and environmental stress. The Israeli and Egyptian blockades, in place since 2007 following the rise to power of Hamas, have restricted the flow of goods and people in and out of the territory, undermining the capacity for significant infrastructure development and repairs. The situation is compounded by periodic hostilities, which result in widespread destruction, including to crucial water and sanitation facilities. This shortage of toilets, particularly in the more impoverished areas and in the makeshift camps hosting internally displaced people, contributes to the spread of diseases and presents a severe threat to the health of Gazans. Poor sanitation facilities can lead to the contamination of water supplies and the proliferation of waterborne diseases such as cholera, dysentery, and typhoid. Moreover, the lack of access to adequate sanitation infringes on personal dignity, privacy, and the basic human rights of individuals, challenges that are magnified for vulnerable groups such as women, children, and the elderly. The crisis, according to the UN official, calls for urgent international attention and aid, focusing on both short-term relief and long-term sustainable solutions. The news is particularly relevant today as the international community considers global public health in the wake of the COVID-19 pandemic, which has highlighted the critical importance of hygiene and sanitary living conditions in preventing disease transmission. It also raises important questions about the role of ongoing conflict in humanitarian crises and the responsibilities of the international community to safeguard basic human rights under such conditions. Efforts by international organizations, local NGOs, and community leaders have continued, seeking to address immediate sanitation needs while also advocating for broader political and infrastructural solutions. Sustainable interventions include the reconstruction of sewer systems, the provision of mobile toilet units, and the establishment of water treatment facilities that are resilient even during conflicts. The crisis in Gaza serves as a reminder of the profound impact that geopolitics and conflicts can have on the daily lives of ordinary people, turning even the fundamental need for sanitation into a challenging endeavor. As the international community grapples with a multitude of global challenges, the situation in Gaza offers a poignant case study of the human costs of conflict and the urgent necessity for peaceful resolutions and humanitarian aid.